Ever wondered how a drug test is done? Today, we unravel the science behind it. Drug testing plays a crucial role in various domains of our lives, from ensuring workplace safety and fairness in sports to legal proceedings. The process is generally twofold. It begins with a preliminary immunoassay test, a quick screening method, followed by gas chromatography, a more specific and precise technique. So, let's dive into the journey of a sample, starting with the preliminary immunoassay test. The first step in the drug testing process is the preliminary immunoassay test. This test utilizes the interaction between an antibody and its corresponding antigen or target. The immunoassay test measures the presence of drugs in a sample by observing this reaction. Antibodies can be made to find almost any substance within a body. It works like a lock and key mechanism, where the drug or its metabolite acts as the key, and the antibody is the lock. When the key fits perfectly into the lock, it signals the presence of the drug, resulting in a positive result. We usually call this a non-negative because technically it's not truly positive, yet it's important to note that this is a preliminary test. Like a rough diamond, the results can sometimes be misleading, with false positives occasionally cropping up. The reasons for this can be various, ranging from the presence of certain medications to specific dietary habits. But to confirm a positive result from the immunoassay test, we need to perform another test, a more specific one called gas chromatography. Gas chromatography, or GC, provides the specificity needed to confirm a positive drug test. Now, let's delve into this fascinating process that separates and analyzes compounds. GC turns the urine with all of its compounds into a gas. Then the gas is carried through a column and all the individual compounds are separated out. Imagine a runner racing along a track. In the world of gas chromatography, the track is the column and the runner represents our compound of interest. The other compounds within the specimen are the other runners. The race begins when the sample is vaporized, turning into a gaseous state without falling apart. It's then carried through the column by an inert gas, much like a gentle wind pushing our runner along the track. As the sample travels, it interacts with the material inside the column, causing different compounds to travel at different speeds. Some compounds, like our faster runners, reach the finish line quicker. Once these compounds cross the finish line, they are detected and analyzed. The time it takes for a compound to travel through the column from start to finish is its retention time. Each drug or metabolite has a unique retention time, much like each runner has a unique running speed. This unique characteristic allows us to identify the specific drug or its metabolite in the sample. With the help of gas chromatography, we can confirm whether a positive result from the immunoassay test is indeed accurate. So, how does a drug test unfold? It's a two-step process. First, the preliminary immunoassay test screens for potential positives. Then, gas chromatography steps in, pinpointing the exact drug or its metabolite. Remember, the goal of drug testing is to ensure safety and fairness, whether it's in the workplace, sports, or other areas of life.